welcome back to Latina Medlife. I am so glad to have you here. We are continuing from where we last left off before things got a little dark. Okay, we're going to be talking about the cons of being a CNA. I'm probably going to refer to some of the pros just in case you need a refresher here and there when I see fit. But let's get right into it. Okay guys, being a CNA is physically demanding. Let me tell you, my body, I am young, but I feel like a 50-year-old woman sometimes, and I don't mean that like I'm not discriminating against any age group, but I'm just saying, like, after a shift you feel so sore. Your legs hurt, your arms hurt. For some reason, when I overuse from like turning and pushing and pulling, like my arm will start to hurt like really bad. I'll even put like patches on there and stuff like that. I know many CNAs who have blown out their backs, CNAs who have had to get surgery, CNAs who've had to get surgery because of knee problems, because you're standing for long periods, because you're running back and forth from room to room because that call light is going off and someone needs help and someone's about to fall off a toilet, things like that. But just physically demanding. Like I said, you will have a nurse come in. Say you're changing someone, right? You're changing somebody and you know, you're like, oh, okay, yeah, I'm just, I'll be done in like 5 minutes. Okay, someone from room 314 needs you next, and you have a call light at 215B. And then you're like, okay, I have 2 more people waiting on me, right? And then you might have another nurse come in the room and ask, hey, do you know if so-and-so peed yet? Have they peed? What's their urine output? And I have to think, I'm like, the catheter, I think, urinal, they peed about 300 milliliters. And I'm there, wiping someone's tush. You know what I'm saying? So, physically demanding in that you are pushing, pulling, turning. A lot of CNAs are injury prone. Like I said, one of the ones that I knew who had to have knee surgery just because, you know, you're always on your feet. You want to get comfortable shoes. Like, guys, this is not a glamorous job. It's not a glamorous job at all. Like, don't be fooled by people who look really cute in their scrubs, like, and they post pictures. Like, those pictures are before work. Let me tell you, your scrubs will have so much feces and urine on them that you, like, when you're around other people, just even getting out of your car, like, they'll look at you like they can smell the stink. You know, they can smell it. Okay. But again, back to the physically demanding part. You will have an array of patients and residents, whatever setting you're in, that you're caring for, and some of them may be obese, and I mean like 300 plus pounds obese, where, you know, they're bedridden because they're so heavy, and because it's so cumbersome for them to move. It hurts. You will notice that, you know, people who are obese, what makes it so painful sometimes for them to hurt is that they have these deep wounds, like these almost like these cuts, because the skin, sometimes the skin is so it's a little hard to explain, but just imagine that because the skin is kind of overlapped, a lot of like sweat accumulates and things like that in those areas, and if you don't keep it dry, say like under like an armpit flap, if you don't keep it dry, it will accumulate bacteria and things like that, and so to move it really hurts, and sometimes there's little cuts in that area, things like that. So sometimes people aren't always feeling good, you know, like someone's been in an accident and they have stitches, and now let's just say they're feeling really sick because they had to take a certain medication and they have diarrhea, and they're just like, oh my god, my stomach hurts, and you're like, okay honey, I'm just gonna move you to the side, okay, we're just gonna move you to the side, okay, you know, and it really hurts for them, so you have to be very like gentle. You can't like try to be very fast and just get things done. Like, it doesn't work like that, especially if you're like transferring disabled people, right? Someone who's had a heart attack, someone who's had a stroke, all these things. It's demanding in that way. pushing, pulling, carrying, turning, transferring people from their bed to their wheelchair, back from the wheelchair to the bed, from the bed to the wheelchair, and then to the bathroom. Like it's very demanding. And I'm 5'0". I'm 5'0", and I weigh like 112 pounds. Sometimes when I have people that are a little heavy for me, I'm like, okay, I need another CNA. I'm gonna go find another CNA. Just give me like 5 minutes. Sometimes you will need help, and there are going to be times where you're alone and there's not a nurse or a CNA, or people are super busy and slammed, and there's all kinds of things going on, and you have to make the right judgment calls. But that's leading into my next point, that CNA can be very stressful and emotionally draining because of situations like that, right? Like imagine I guess like what I'm trying to say is, it's stressful because people are sick. You're helping people that are sick, people that have incisions or wounds. Someone was in a car accident and now they have like this big open wound, and they have the wound vac on there, and the wound vac basically, like, it takes out all of like the pus and all of that stuff. But people are just very sick. You might have someone that has cancer or is recovering from cancer, and like they're just like really out of it. Or you might have people that are in a comatose situation where they're like almost in like a vegetative state, and you have to bathe them, you have to transfer them. And I mean, there are machines like a Hoyer lift, for instance, where you go and there's a technique to put it under a patient and get them basically transfer them from their bed to like a shower chair, and then you can shower them and things like that. Sometimes that works. There's different things that you can do, but the point I'm trying to make is that what makes it stressful and draining, again, you're dealing with people who have acute or chronic illness. So it might just be something short term. Acute could be like a cold or the flu, things like that, or it might be chronic, like they might be on dialysis for I want to say like kidney. I want to say it's like kidney failure, or like they might have liver disease or something like that, and the way that you would care for them is just very different from the way that you would care for someone else. Now, point number 3 to be made. Cons 3. It's dirty work and it's not glamorous. I think I said that in the other video. You are dealing with blood, urine, feces, vomit, pus. It's dirty, like work. You're gonna go into situations, people may have scabies, they may have staph infections, Staphylococcus aureus, Staphylococcus epidermidis. Like there's so many things. They might have C. diff, and these things are contagious. You have to make sure that you are donning your PPE, that you're washing your hands, you are being very diligent about hand hygiene, things like that. And each state is different, like the requirements for CNA. You might have to work with colostomy bags. Your nurse might be like, oh, colostomy bag is full. And if you ever worked with a colostomy bag, and someone's bowels will say are not working properly, everything gets emptied into this bag. And so if you can imagine, it's pretty much like feces. And when you open the bag, it smells very like gas. Like if someone's gassy, right? Someone's like farting, it kind of smells like that farty smell, because it's that's what it is. But you might have to clean those things out, and so if you're very queasy, it might be a little bit hard for you. You're draining catheters, right? Someone's having UTI or some issues, and they want to monitor how much this person is peeing or not peeing. You're there. Or just imagine this is like a urinal. You're there, emptying the catheter, measuring the catheter, measuring the urinal, you're checking 300 milliliters, like you're charting all of this stuff, right? A lot of what their health care plan entails is going to be what you chart and things like that. It's very important that you are accurate about those things. Don't mind me, I'm just looking at my notes. Like I said, it's dirty work. I have plenty of stories, but I'll just say accidents happen. I've had poop on my shoes, poop on my scrubs. I've been in situations where I change someone and say they're not ready. They can't feel when they have to use the bathroom, right? They're incontinent of the bowel or the bladder. I'll change them, everything is good, and then boom, they start going again. And I'm like, oh Lord, okay. Always make sure you have an extra brief on hand. These situations do happen. You know, your gloves will get dirty. It's inevitable. But let's move on to point number 4, cons. So people are sick. People are tired. People are angry. People are frustrated. Ask yourself, how would you feel if your family took you out of your home, you know, and put you in a nursing home because you are having difficulties with your health and they feel that they are not credentialed enough to be able to take care of you, right? Half the time you have to put yourself into your patient or resident's like mind, right? Because people will act very mean towards you. And I will elaborate in just a bit, but imagine, right? You get taken out of your home and your family is like, we can't take care of you, we're really sorry, you know, and now they're going through a transition. They just went from being in their home into a room, and sometimes they're sharing it with other people. You know, that has to be tough. Imagine having your space and then boom, it gets taken away from you, and now you're living with 2 other people in a room, sometimes even 3 other people. You know, so sometimes they're a little cranky, right? Sometimes you have people who are severely depressed. You have people who are trying to commit suicide. People who are on suicide watch. You have people who are in these situations basically where they're not feeling well, and you have to understand that they don't mean to take it out on you, but it's gonna happen. I can tell you, I've been punched, I've been kicked, I've been scratched, I've been slapped, I've had my hair pulled really, really hard. Not everybody is of sound mind, right? Say someone has dementia or Alzheimer's and you tell them, hello, Mrs. Jones. Hi, Mrs. Jones, I'm here to change you. She's like, I don't know who you are. Get away from me. You're like, Mrs. Jones, it's time for me to change you. You defecated on yourself, or you urinated on yourself. I didn't do that. That's not me. No, that's not. You put that there. And you have to learn how to be in situations like that and still get your job done. Okay, Mrs. Jones, I know you don't remember, but I'm going to change your brief, okay? It would really help if you help me. You know, just little things that you learn on the job that you wouldn't otherwise learn in school. In school, you're practicing on a mannequin. The mannequin's not going to go boom, you know? The mannequin is not going to do that. The mannequin's not going to kick you in your stomach or punch you. Like, the mannequin's not going to do that. People will. People will. They don't know who you are, right? And then you have people who have psychological issues, who are literally on antipsychotics, who are going to try to beat you with a call light. Like, you have to be prepared, and you have to understand that they don't mean to do it. It's not coming from a place of, like, I genuinely want to hurt you. Like, it's coming from a place of, I'm scared, I don't know where I'm at, and I'm confused, right? Sometimes people are not alert and oriented. That's what we say when someone's like of sound mind. They're alert and they're oriented, right? Okay, little coffee break. I would say this is the biggest con. This is the biggest con of all time. Short-staffed. You will, at some point, have to deal with this situation where you are short-staffed, and it is very, very stressful. It's very, very stressful. What I mean is, for instance, back in the day when my mom was a CNA, she told me 12, if only I had 2 more fingers, 12 patients, residents, that's the most people she ever had. And that the full 12 was really heavy right? Because the nurse needs you to get vital signs for so-and-so. The nurse needs to see the blood pressure for so-and-so so that she can give them insulin. Nurse needs you to change person in 314. Another nurse comes and they're like, hey, we're really, we don't have enough people at this station. Is it okay if we take you and we move you to another station? And you've already finished all of your work. And then you have to go and you have to start all over again when you were ahead of everything. This is what happens when you're short-staffed. Now, let me tell you, there are times that I've had 13, 14, 15, 16, 17, 18, 19, 20, 21. The number goes up higher and higher and higher. And the truth is, these are very unsafe ratios, but nothing ever really gets done about it. And again, CNA being so difficult to do because it's so demanding, you know, like there's a million things you have to do in so little time. A lot of people can't handle the stress. They can't handle the stress, and so they leave. I've heard stories of people who walk in, it's their first day, they see the unit, and they walk out. Or they make an excuse like, oh, I have to get something from my car. And then you never see them again. You know, it's very difficult. Or like, oh, you're the only CNA on the floor and there's 40-something people, you know? And when I talk about it with my mom, like she's like, 12 people back in my day was a heavy and hard night. I can't imagine juggling 20-something. And imagine that, that's us CNAs. Your nurse has even more than that. So very high stress, very high stress because it's short-staffed. High turnover, right? Just high turnover. Some people are just, they're not down. And you can't blame them because number 6. I mentioned it, but abuse from patients. So when I said, like, point number 4, people are sick, tired, cranky, sometimes even entitled, the abuse is so real. Like, in your mind, you know that nobody is out to hurt you, right? No one is out to hurt you. They're not physically trying to hurt you. But just imagine day in and day out, you're getting punched, you get kicked, you get scratched, you get your hair pulled, and it can be very demoralizing and demeaning when the one thing you wanted to do was just help somebody. I'm here to help you, right? Like you go into the room and you're like, I'm just trying to help you, you know. You have poop all over the bed. There's you peed through everything, and we have to change it out. It's very difficult because people don't understand, right? Sometimes they're in a state where they can't understand, but the abuse, it gets to you. Because you think about it like this. In every other workplace, there are measures and guidelines for abuse, right? Like a teacher, if a student goes and like, boom, socks them in the face, like that can be a whole thing, right? That could be like, oh God, restraining order, you know, battery, I want to say. I don't know, I could be wrong about that. But everywhere you work, self-defense is a thing, right? Well, in healthcare, you can forget about that. There is no self-defense. There is no self-defense. That's a whole lawsuit. You can't hurt these people, you know? You can't be like say Mrs. Jones comes and she's like, boom. You can't be like, dang it, Mrs. Jones, boom. You can't do that. You can't do that. Like, you're dealing with very vulnerable, fragile people, but at some point, it does start to hurt a little bit. There are times I've gone home and I've just cried in the shower and I've just been like, all I'm trying to do is help. And they can't understand that. And it doesn't matter. It doesn't matter that they can't understand that. They never will, because they have a psychological condition that alters the way that they think. And that's a hard thing. It's a very hard thing. It shouldn't be the norm going into work and getting your hair pulled or getting slapped, or even the verbal abuse. I'm not gonna lie, I've been called, I don't even know if YouTube will allow this, I've been called a I've been called so many things. Stupid, idiot, dumb, like every bad word, honestly, that I'm not gonna say, I've been called that. Just for trying to help somebody. Just for trying to shower somebody and make sure they're clean. I have to make sure you're clean. I have to bathe you. Oh, I don't give a... You stupid. Get away from me. Get away from me. Like, this will be your everyday, and you just have to learn how to say, okay, it's one of those days. Now I need therapy. No, I'm just kidding. God, hope you guys didn't see that. But those are the things. Those are the cons. And you know, the truth is, I have to leave this with you guys on a happy note, because, or on a somewhat happy note. You're gonna deal with this. As a nurse, as a doctor, occupational therapist, respiratory therapist, you're going to deal with these things in healthcare inevitably. That's why I think CNA, even though it has its pros and it has its cons, I think the cons really teach you a lot about you, how you handle situations, and I think it teaches you a lot about whether or not the field is for you. You know, because I've read so many stories about nurses who are working in like the emergency department and someone is hiding a machete in their pants or whatever, right? And then the police are like, okay, we're gonna check you, and then boom, find the machete. Like, there are so many situations. Oh, I heard another story, I don't know if you guys know about this, but a woman, a nurse who was pregnant, who was, I think one of her patients like abused her, punched her or something. She lost her baby. She lost her baby because he hit her really, really hard in the stomach. So that's the other thing. Like, again, people don't talk about healthcare and things like that and abuse in healthcare, but this will be your everyday, and you really have to think about whether or not this is for you. And again, future CNA students or current CNAs or future nursing students or wherever you are and you're thinking about CNA, know that it's not just CNA where these things happen. This is healthcare. This is the profession that you're going into. You have to be ready to combat those things. And no textbook is going to teach you how to deal with those situations, unfortunately. So I almost want to say you should get your experience, and you should figure out sooner rather than later if it's for you. Now, if there's anything I didn't cover about CNA that you guys feel like I should, do leave a comment. Yeah, I'm totally open to that. I can talk about my CNA story, how I got into that, the millions of times my major switched, and all of that fun stuff. But I hope to see you in a future video, and really ponder on those things. There was one thing that I didn't mention actually, and that's the aspect of when I said like it's stressful and emotionally draining, people are sick and like, you know, people die. And part of the job description of being a CNA is that you have to learn how to take care of a body after the person has passed. Now, I can get into that topic on a whole other video, and maybe I will in the future, but just briefly to tell you, it is in your job description as a CNA to prepare the body for the family. So after someone has passed away, you have to shower them, bathe them, do their hair. Typically the family will say, if so-and-so passes, please put this on them, put the rosary, or make sure that she has her Bible or he has his Bible, things like that. You have to be prepared for the fact that healthcare has a lot of sick people, and a lot of people do die, and it's very sad to sometimes see people in these states where they are paralyzed in a comatose-like state. And if you start to feel a little shifted by it, it would be good to seek therapy and things like that. Because think about it, everybody who's doing their regular thing on a regular day basis, whether they go to school or they go to work or they're in another job industry, they don't see the things that you see every day. They don't see people depressed and not eating. They don't see people trying to commit suicide. They don't see people not taking their medications because they tell you, I want to die. I don't want to be here anymore. I just want to die. Other people don't deal with that. But you will if you go into healthcare. You will see very depressed people. You will see dying people. You will see people who, you know, need comfort and care and all of these things. And so really ponder on that, think on that. And again, experience is the best way to know if something is for you. A textbook is only going to teach you so much. You can only read about death so much. When it's there in front of you, the scent, the smell, the everything that comes with it, only then will you really know if it's for you. So nevertheless, I will see you guys in a future video. Thank you.